the Great Western Hospital in Swindon. The aim of this video is to give you post-operative advice and exercises following your total knee or uni knee replacement. Hopefully you've had a chance to read through the booklet you were issued pre-operatively. As with any surgery, there can be a risk of complications, and one of those complications can be infection. Some of the symptoms to look out for include increased redness and a shiny appearance to your knee, an increase in swelling and temperature, and a change, generally an increase in pain around the knee. You may also notice a discharge and odour coming from the scar, and you may start to feel unwell and have a temperature of greater than 38 degrees. If you experience any of the symptoms mentioned, please seek urgent medical advice. Blood clots can also be a serious complication post-surgery, and these are generally in the form of a DVT. If you experience increased swelling or pain in the back of your calf, or you are struggling to weight bear, please seek urgent medical advice.
I'm briefly going to speak about early expectation following a knee replacement. A knee replacement is a major operation and progress may seem slow. The recovery process can take some time and it occurs at a different rate in individuals, so please try not to compare yourself to others. Pain is a common occurrence post-operatively and can last up to 18 months. Referred pain can be experienced in the back of the knee and down the shin. This is normal and to be expected and should decrease over time. The pain you experience should be different to your preoperative pain. We encourage you to take your prescribed pain relief for its duration. If you feel that you're not on adequate pain relief, then please contact your general practitioner. It's common for swelling and warmth to occur post-operatively. This can occur for up to 2 years. In the early stages, it's important to help manage this. We encourage the use of ice. Try wrapping ice or frozen vegetables in a damp cloth and placing it across your knee. Try this for up to 30 minutes every hour.
Numbness can be a common side effect post-operatively. This can normally be felt around the scar site or around the outside of the knee and is due to the small nerves being cut during surgery. It can take over 5 years for this area to reduce and may remain unresolved, but this is completely normal. It is normal for your knee to feel quite stiff post-surgery. To help manage this, try to move your knee every half an hour to help break down scar tissue. To also help manage this, you can use heat from 3 weeks post-operatively in the form of a hot water bottle or a wheat pack. Place this over the front or the back of the knee or on the top of the thigh. Self-massage can also aid swelling and stiffness and will be shown later on in the video.
Regarding range of motion, we expect you to be able to achieve a straight knee and at least a 90-degree bend. Post-operatively, some people find that they can kneel, but unfortunately this isn't guaranteed. In relation to driving, we advise that you don't drive for 6 weeks. When returning, it's important that you can perform an emergency stop and your insurance company is aware. On return to work, in a sedentary job, you may find it takes 6 weeks. On a more manual job, you may find it takes 12. When returning to lifestyle activities, a good exercise to begin when your wound is healed is walking in a swimming pool. This will help reduce swelling. As you begin to become comfortable, you can then begin to swim. You should aim to achieve a heel strike when your foot initially contacts the floor, and you should aim to bend your knee once you have stepped onto your other foot. You are likely to have been discharged with 2 walking sticks and should be aiming for a normal walking pattern. Initially, you may have a 3-point walking pattern. Bring your sticks forward first, then followed by your operated side, then your non-operated side. As you progress, you can bring your opposite arm and leg forward at the same time. Aim to get equal weight through both legs and aim to continue to heel strike when your foot hits the floor. Once you feel confident in the strength and movement of your knee, practice walking indoors with 1 walking stick in the opposite hand. It is advised to have someone close to you when you initially attempt this. As you get more confident, try mobilising short distances outdoors. By 6 weeks, you should be able to climb and descend the stairs with the use of rails. In the initial weeks following your surgery, you may need to adapt how you use the stairs. This may mean taking both legs onto the same step before progressing onto the higher step. When ascending the stairs with the help of a rail, we encourage you to take your non-operative leg up first, followed by your operated leg and then the stick. When descending the stairs with the help of a rail, we encourage you to bring your stick down first, followed by your operated leg, and then bringing your non-operated leg onto the same step.
Sit to stands. In a couple of days after your operation, you may want to slide your leg forwards in order to stand and sit into a chair. Slide your operated leg forwards and place both hands on the arms of a chair. Lean forwards and then push up into a standing position. In order to reverse this movement, make sure you can feel the chair on the back of your calves. Slide your operated leg forwards, reach back for the arms of the chair and slowly sit down. We only encourage you to do this for a couple of days post-surgery. After a couple of days, aim to stand and sit into a chair, keeping your knee as bent as possible. Keep both feet flat on the floor, reach your hands to the arms of the chair and lean forwards, pushing up into a standing position. This will be uncomfortable over the front of your knee, however it will aid in the bending movement. In order to reverse this, feel for the chair with the back of your calves, reach back for the arms of the chair and slowly lower yourself down into it. As your knee range of movement and strength improves, aim to stand and sit into a chair without using your arms. Again, keep your feet flat on the floor, lean forward and push up into a standing position. Again, feel for the chair on the back of your calves when you go to reverse this movement and then slowly sit down. This first group of exercises can be completed 10 times, 2 to 3 times a day, and can be started from day 1 post-op. Heel slides. Place your heel on a plastic bag and slowly slide your heel up towards your bottom, trying to encourage the bend in your knee. Slide your heel away from you, returning to a straight knee. The next 3 exercises target your quadricep strength. With your leg out straight, tighten your kneecap and push your knee down into the bed. Hold this contraction for 3 seconds and then release. Inner range quads. Place a rolled up towel under your knee. Lift your heel up off of the bed by tightening your thigh or quadriceps muscle. Hold this position for 3 seconds before slowly lowering the heel to the bed. Straight leg raise. Your aim for this exercise is to lift your leg without dropping the knee. Start by tightening your thigh or quadriceps, pull your toes up towards you and lift the whole leg off of the bed. Aim to hold this contraction and your leg in the air for up to 3 seconds. Slowly lower the leg without the knee dropping. Bridges. Lying on your back with your knees bent up to a comfortable angle and your hands flat on the bed. Squeeze your bottom muscles and lift your hips up to the ceiling. Again, hold this contraction for 3 seconds before slowly lowering back down to the bed.
Static bike. If you have access to a static bike at home, you can start to use this from 7 to 14 days post-op when your wound has healed. Initially, you want to go forwards and backwards on the pedals rather than a full cycle. Once your knee range of movement has improved, you can start to go round a full cycle, pushing down through the heel and then pulling up through the knee.
If you do not have access to a static bike, you can purchase pedals off of the internet and use them at home. You'll need to use a chair and block the pedals against a wall or a sofa. Again, start off with going halfway round on the pedals to stretch the knee until your knee range of movement improves and you can get a full cycle. Standing at your kitchen worktops, aim to bend the knee by bringing your heel up towards your bottom. Slowly lower your foot down to the floor. Balance work. Aim to stand on one leg, initially standing by your kitchen worktops. Hold on with both hands. As this gets easier, reduce your pressure through your hands to your fingertips, to one hand, and then to no support. If you are feeling particularly wobbly to start off with, do this while somebody else is present. Self-massage. The aim of the self-massage is to help reduce swelling and to aid the stiffness within your knee. Once your wound is clean and dry, use a moisturising cream to massage the swelling and massage your muscles in the direction up towards your groin. Complete this on the front, the sides, and the back of your knee.
As well as using massage to aid your swelling management, you can use it to increase the suppleness of your wound. Your wound can be healed between 7 to 14 days, and after this time it is useful to start massaging. In order to do this, pick up the sides of the wound and roll them over the knee. You can also rub across the skin, pressing down onto the scar to break down any scar tissue. Make sure there isn't any friction and you are pressing down onto the wound.
Patella mobility. Your patella, also known as your kneecap, is located at the front of your knee and can become quite stiff following surgery. Using the web space in your hand, place this over the top of your kneecap and slowly and gently glide your kneecap down towards your toes. You are not pushing your kneecap down into your knee. Repeat this 5 to 10 times.
You can also mobilise your kneecap in a side-to-side position. Pinch the kneecap between your thumb and first finger and gently slide from a side-to-side movement. Again, repeat this 5 to 10 times.
The next group of exercises are stretches. The stretches can be held between 20 to 30 seconds and repeat them 3 to 5 times. Again, you can complete these exercises a couple of times a day. Heel props. This stretch is extremely important to help regain the extension, otherwise known as the ability to straighten your knee. Place a large rolled up towel underneath your heel and let your knee hang in this position. You will feel the stretch at the back of your knee. You can keep this position for up to 2 minutes. This can also be completed while sitting in a chair with your heel on a coffee table or a footstool. Leg hangs.
Lie on your front and place a towel underneath your leg, with your heel and foot hanging off of the bed. You will feel a stretch along the back of your knee. This stretch will help you gain your extension, again the straight movement in your knee. As this gets easier, remove the towel and let your leg hang in this position. Lunges on the stairs. Place your operated leg on the bottom step of the stairs and bend forwards with your knee. You should feel a stretch along the front of the knee. Calf stretches. Standing on the bottom step of the stairs, move your foot backwards so you're resting on your toes and push your heel down to the floor. You should feel stretch down the back of your calf.